Hello guys, today we'll be talking about schistosomiasis, and we'll be talking about schistosomiasis under the following headings: introduction, causative agents, life cycle, epidemiology, risk factors, diagnosis, prevention and control, as well as treatment. What is schistosomiasis? Schistosomiasis is a chronic parasitic disease that is caused by trematode worms of the genus Schistosoma. Schistosomiasis is one of the most prevalent neglected tropical diseases, and it constitutes a major public health problem, particularly in sub-Saharan Africa, parts of Asia, South America, and the Middle East. The disease is strongly associated with poverty, inadequate sanitation, as well as poor health infrastructure and limited access to clean and safe water. The disease predominantly affects children and adults, causing chronic ill health as well as impaired growth and cognitive development in children, reduced work productivity in adults, and severe complications such as hepatic fibrosis, as well as portal hypertension, bladder cancer, and renal failure if left untreated. Transmission occurs when humans come in contact with freshwater bodies contaminated with Cercaria, which is the infective larva stage of the infection, released by freshwater snail, which are the intermediate hosts of the infection. Let's talk about the causative agents. The causative agents of schistosomiasis are blood flukes that belong to the genus Schistosoma. They are blood flukes that belong to the genus Schistosoma and the class Trematoda, as well as the phylum Platyhelminths. Schistosomiasis is caused by blood flukes that belong to the genus Schistosoma, class Trematoda, and phylum Platyhelminths. Right? Unlike most trematodes, schistosomes are dioecious. They are not hermaphrodites, meaning that they have a distinct male as well as a distinct female. The major species of schistosoma that cause schistosomiasis in humans are basically three, and they include Schistosoma hematobium, Schistosoma hematobium, Schistosoma mansoni, and Schistosoma japonicum. Schistosoma hematobium, Schistosoma mansoni, and Schistosoma japonicum are the three major species of schistosoma that cause schistosomiasis in humans. Schistosoma hematobium causes urinary schistosomiasis. It causes urinary schistosomiasis that primarily affects the urinary bladder as well as the ureters. Schistosoma mansoni causes intestinal schistosomiasis, which affects the colon as well as the liver. Schistosoma japonicum causes intestinal and hepatosplenic schistosomiasis. Schistosoma japonicum produces the most eggs. It produces about 3,000 eggs per day, which is roughly 10 times the amount of eggs produced by Schistosoma hematobium and Schistosoma mansoni. Schistosoma japonicum also causes the most severe form of schistosomiasis. It is important to note that apart from the clinical manifestation of the different forms of schistosomiasis, a major way in which the different forms of schistosomiasis are diagnosed is through the eggs that is released by the different species. It is important to note that Schistosoma hematobium has eggs that have a terminal spine. Schistosoma mansoni has eggs that have a lateral spine, while Schistosoma japonicum produces eggs that have a lateral knob. So this is the egg, right? This is schistosoma S hematobium. This is S mansoni, and this is S japonicum. The egg of schistosoma hematobium produces eggs that have a terminal spine, right? While the egg of while schistosoma mansoni produces eggs that have a lateral spine, and schistosoma japonicum produces eggs that have a lateral knob. So this is a very important diagnostic feature of schistosomiasis. It is also important to know that there are other species as well of schistosoma that also cause disease, and these species include we have schistosoma schistosoma intercalatum. We have schistosoma intercalatum as well as schistosoma meckongi. Schistosoma intercalatum and schistosoma meckongi are some other species that also cause schistosomiasis. These species, schistosoma intercalatum and schistosoma meckongi, are less common, but they are also clinically relevant in some specific regions, such as northern Cambodia, Laos, etc. So this is basically about the causative agents of schistosomiasis. Let's talk about the life cycle of schistosomiasis. Okay. The life cycle of schistosomiasis involves, the life cycle of schistosoma species rather, involves two hosts. Humans serve as the definitive host, while freshwater snails serve as the intermediate host. The life cycle begins when the eggs of schistosoma species are released via urine or feces, depending on the species type, and they are usually released from infected individuals. Eggs of schistosoma hematobium are released via urine, while eggs of schistosoma mansoni and schistosoma japonicum are released in feces. When these eggs are released, they enter into freshwater bodies. In the freshwater bodies, once the eggs enter the freshwater bodies, the eggs hatch to produce a miracidium. Eggs hatch in freshwater bodies to produce a miracidium. The miracidium is a free-swimming as well as a ciliated and larval stage of schistosoma species. It has cilia, right? Numerous cilia. And this cilia present in the miracidium enables it to swim and move freely in the fresh water body. And it's also important to note that the miracidium is the first larval stage of the schistosoma species. When the miracidium is enters, when the egg hatch into the miracidium, this miracidium then infects and enters into a freshwater snail. The miracidium enters a freshwater snail, and once in the freshwater snail, the miracidium develops into a sporocyst. The miracidium develops into a sporocyst. The sporocyst multiplies and produces cercaria. Sporocyst multiplies and produces cercaria. The cercaria, once produced, is released from the freshwater snail, and the cercaria is the infective stage of the schistosoma species. So the Shigella, once in the freshwater body, then infects humans that are present in that freshwater body, right? The Shigella penetrates the skin of susceptible humans in the freshwater body. When the Shigella penetrates the skin, the Shigella detaches its tail in the freshwater body and enters into the skin of the susceptible human, forming a schistosomole. Forming a schistosomole. The cicada enters into the skin of a susceptible human host in the freshwater body, cutting off its tail and forming a schistosomole. The schistosomole, once in the skin of human, then penetrates from the skin into the bloodstream. In the bloodstream, it first of all migrates to the lungs, and from the lungs, the schistosomole migrates to the liver, where it undergoes maturation to form an adult worm. The adult worm in the liver has then migrates to various destinations, and the destination it migrates to depends on the species of schistosoma. In schistosoma hematobium infection, adult male and female migrates, they pair up and they migrate to the vesical veins where mating occurs, and the fertilized female then releases its egg into the urinary bladder, and from the urinary bladder the eggs are excreted into urine. But in schistosoma mansoni and schistosoma japonicum infections, adult male and female pair up and migrate to the mesenteric veins where mating as well occurs, and the fertilized female releases its eggs into the gastrointestinal tract, where the eggs are then excreted into or via feces, continuing the life cycle. So this is basically about the life cycle of schistosoma species. Let's talk about the epidemiology of schistosomiasis. Schistosomiasis is endemic in over 70 countries with more than 200 million people infected globally. The highest burden of disease is in Africa, especially by infection with Schistosoma hematobium and Schistosoma mansoni. Schistosoma japonicum causes the most infection. It is the predominant cause of schistosomiasis in Asia, particularly in China and the Philippines. Schistosoma mansoni is the predominant cause of schistosomiasis in South America and the Philippines. In the Middle East, there is a mixed species distribution, meaning that schistosomiasis is caused by Schistosoma hematobium, Schistosoma mansoni, as well as Schistosoma japonicum. Let's talk about the risk factors. There are certain risk factors that predispose an individual and that make an individual susceptible to acquiring or contracting schistosomiasis. Some of these risk factors include engaging in activities that promote frequent exposure to freshwater bodies. Such activities include swimming, bathing, or washing clothes in freshwater bodies. Also, poor sanitation as well as open defecation practices, urination in freshwater bodies, occupational exposure such as fish farming, as well as irrigation work and dam construction, lack of health education, low socioeconomic conditions, and living in endemic regions are some of the risk factors that are predispose individuals to acquiring schistosomiasis. Let's talk about diagnosis. The diagnosis of schistosomiasis is based off of clinical evaluation, laboratory investigation, and imaging studies. Schistosomiasis doesn't usually show immediate symptoms. Symptoms become evident several weeks after infection. Some of these symptoms may include itchy skin, popularly referred to as swimmer's itch. Swimmer's itch. Yeah, swimmer's itch. Other symptoms may include fever, as well as chills, cough, muscle ache, and fatigue. Later symptoms depend on the particular species of schistosoma causing the infection, and this symptoms may include abdominal pains, bloody urine, enlargement of liver, as well as chronic fatigue. In terms of laboratory investigation, urine microscopy, particularly the midday urine, is used to detect schistosoma hematobium eggs. Also, stool microscopy using direct microscopy, direct wet mount, catho-cast technique, and former ICAR concentration techniques are used to detect eggs of schistosoma mansoni, schistosoma as well as schistosoma japonicum. Serological tests are utilized to detect antibodies that are to detect antibodies against the schistosoma antigens. And these serological tests are usually used in low intensity infections. Molecular techniques like the polymerase chain reaction are used to detect the parasite DNA, the schistosomal DNA, and this facilitates sensitivity, increased specificity, accuracy, and precision of diagnosis. Also, imaging studies are performed, such as the ultrasound, to detect liver fibrosis as well as bladder wall thickening. Let's talk about prevention and control. Prevention and control of schistosomiasis is basically based off of health education to create awareness on transmission, prevention, and control of schistosomiasis. Also, improved and adequate sanitation, very important, access to clean and safe drinking water. Also very important is the use of molluc sites. Molluc sites are used to control snail population, helping to limit transmission of infection. Mass drug administration is also employed to serve and ensure periodic therapy of high-risk individuals. These are basically some prevention and control strategies. Let's talk about treatment. The treatment of schistosomiasis is basically done using praziquantel. Praziquantel. Praziquantel is the drug of choice used in therapy of schistosomiasis. It is effective against all species of schistosoma. Alternatively, ozamniquin is also used. Ozamniquin. Alternatively, ozamniquin is also utilized as therapy, as a therapy measure against schistosomiasis. Artemisinin derivatives can also be used as an adjunct therapy. So this is basically about the treatment of schistosomiasis.